Hi everyone. I've been doing a series on cancer literacy in my live stream Facebook videos, but today I want to do a bonus video which does have a lot to do with cancer care, but also any kind of general health care. And it's an important message for the public about nurses and the healthcare system, what you should know. Okay, nurses are everywhere. I mean, we do a lot of different roles in healthcare, but when it comes to healthcare facilities and hospitals, nurses are an expense. So they're paid hourly, they're staffed as labor, they are there to cover the number of patients in the hospital or clinic each day. You won't see a bill for nursing care, just like you won't see a bill for washcloths or bedpans or blankets. That means the people who run the facility see nurses as a cost. And when you're running a business for making money, your goal is to reduce your costs as much as possible. So it can be very tempting to minimize the cost of nursing by cutting corners, having as few nurses on staff as possible, and giving nurses more patients to reduce the hospital's expenses on nursing. Okay. So there are a lot of different ways they do this. They send nurses to different floors to fill in gaps where the nurses might not be as familiar with those types of patients. They hire expensive travelers and temporary nurses to fill in those gaps in the schedule. They reduce nurses' benefits and hours. They might get rid of experienced older nurses who are expensive and replace them with more inexperienced younger nurses. They sometimes require nurses to work on call or mandatory overtime and basically have as few full-time nurses employed as possible. And what that means is that there are fewer pairs of eyes and ears to watch you trying to take care of more patients in a given amount of time. They're more rushed, they have more work to do, they're spread thin for each patient. So that means you, as the patient, are going to be less safe. And what this means for you is, if you are admitted to any healthcare facility or hospital, you should always have someone with you as an advocate to help speak up for you and keep an eye on you and your needs. And if you think your nurses are too busy, you need to voice your concerns to the powers that be. Okay, find out how many patients your nurse has. You should realize that as a healthcare consumer and a potential patient yourself, that nurses are in a survival battle for our profession. Ethically and professionally, we are being asked to do too much for too many with too little. And you, the public, can help because ultimately it's about your safety and your loved one's safety. It's about your lives. So if you or your loved one is being treated in a healthcare facility, there are things that you can do to make things better. Now, I'm going to tell you some things that you can do. And I want to remind you to give credit where credit is due. If someone does a great job for you, mention them, say something, because that's important. But if you are having an issue with either not getting your needs taken care of, or you're not happy with the way you were treated, or there's some safety concern or other issue that comes up for you, talk to the manager of that hospital floor or unit or the clinic. Fill out those surveys. You might even see them lying around in the waiting room, but if you get a survey in the mail after you've been in a healthcare facility, don't miss an opportunity to give feedback. And they really do look at those things. I guarantee you, they will be reading those responses. And I know because they drag nurses and physicians in on a regular basis to meetings where they go over with a fine-tooth comb all of these surveys and patient satisfaction numbers. So yeah, they are looking at those. Talk to the executives, the CEO, Chief Executive Officer, Chief Operating Officer, Chief Nursing Officer. Write them a letter or ask them to give you a call if you have a concern. Another thing you can do is talk to your local media. And I know that in some communities, there really isn't a lot of local journalism anymore. A lot of times they've been sold to the bigger newspapers and media outlets. But if you don't have local media, you can go on social media, write reviews, send messages or comments, because they'll be watching that. And then finally, you as a citizen, you can vote, you can talk to your local representatives, or contact your congressperson, the person who represents you, your district in Washington, or your senator. All of those people have people on their staffs who are charged with healthcare. So you want to talk to them and get the point across to them that, hey, there's a concern I have. We need legislation to make things more safe. So I just really am passionate about this because I want everyone to get the best healthcare possible and to be as safe as possible. And we really all have a role to play in making sure that healthcare serves us. Thanks for listening, and we'll see you on the next video.